Take your feet wide and knock your knees in. You should feel that the sacrum widens versus if you open your knees out, there can be some compression through the sacrum. This will just create a lot of space. Take a few breaths here. You can close your eyes and just check in with your body. Notice any changes of sensation, any release of heat you might experience, any differences between the two sides, how the body might differ from before you started incorporating these techniques. And then taking the feet apart, draw your knees in towards your chest, give yourself a nice big hug. Good, really pressing your belly into your thighs with your inhale, with your exhale, drawing your knees in towards your belly. Good, then taking it to happy baby pose, grab the outer edges of your feet or the backs of the thighs and pull straight down. Good, taking a moment here to press your tailbone and press the back of your head into the floor so your whole spine is supported by the mat. Really long. Good, then from here you might start to rock side to side. Giving the massage to your low back. Good. And again, taking as much time as you'd like here. When you're ready to come out of it and plant your left foot down, right ankle crosses on top, press your right thigh open. This is a great place to stay, to take it deeper into your figure four stretch. Interlace your fingers underneath your hamstring or over your shin. This is a great stretch for the piriformis muscle. Keep pressing your pelvis down. And again, here you might just stay with that static pose. And whenever we say static, there's always actual movement just by the rhythm of the breath, more length through the spine with your inhale, more depth through that stretch with your exhale. But whether you choose stillness or maybe add some movement side to side or circles here, just noticing what your body responds to in this moment. Okay. Spending a minute or so there. And then switching over to the other side. You can always hold these stretches longer, especially if it's after a workout or after you've been more active. That's a great time to take it into longer, deeper stretches. And keep flexing your left foot away from your face here. Again, you might notice a difference between the sides. If one side feels a lot tighter, feel free to spend more time, more breath in that area. Good, and releasing the feet down. Take your right leg up towards the sky, extend your left leg out long. Grab for the outer edge of the leg, so this might be the thigh, the shin, or the outer edge of the foot. Now I like to hook my right thumb and forefinger into the right hip crease, so I'm keeping the hip down, and then pull the leg across the midline. So we're not going for a big twist here. We want to keep the pelvis grounded and just pull the leg across the center. This is a great place to use a strap or a towel to create more length through that arm as you pull the leg across. A great stretch for those muscles, the outer hip. Keeping the hip down and pulling the foot across is what creates that stretch. And oftentimes I do like to take this into a deeper twist, either keeping the legs straight or bent. About 3 to 5 deep breaths here in a supine twist, great for the low back. And then switching sides when you're ready. Left leg will go up, finding the outside edge of the leg, maybe hooking that left thumb into the hip crease to keep the hip down, and then pulling across the center. I always encourage adding movement, playing around with that, maybe drawing some circles by pulling on the foot, just noticing any shift that creates in the stretch. Again, and when you want to release, You might take it into a little twist, keeping the leg straight, continuing that stretch along the outside of the leg, or bending the knee, focusing more on the low back. 3 to 5 breaths here. And then bringing it back through center. Plant your feet down. I'm just going to do some abdominal activation here, focusing on the transverse abdominis, deep abdominal muscle here. Good. So imagining your front 2 hip bones. There's a drawstring between them, and you're pulling it tight. So narrowing the 2 front hip bones in towards each other. Then imagine about 2 inches below your navel, a little zipper, and you're pulling that zipper up towards the belly button. So really just feel that engagement through your center. And can you hold that engagement without too much tension, without gripping, so you can maintain easy breath? Focusing especially on your exhale here to firm that engagement in your low belly. Good. Then we have the narrowing of the front hip bones in towards each other, but taking that a little further by really just imagining there's a corset around your whole abdomen. So there's this wrapping around feeling that activates your transverse abdominis, and it's your exhale where you really find that. You're really pressing all your air out and feeling that wrapping around, that coming in towards the center and the widening of your low back. So take 5 more rounds of breath here to focus in on that engagement. Keeping the neck muscles loose. Give a little shake to your head, side to side, to make sure you're not gripping through the neck, especially those anterior front neck muscles as you engage your center. Good. The next time you find your exhale, you're going to lift your right foot off of the ground. So feeling the engagement and then the lift of the leg. And release the right foot down. Another inhale. As you exhale, narrowing through the front, lift through the left leg. Good. So trying to isolate the engagement in your psoas versus your bigger hip flexor muscles, the muscles of the quadricep that pass through the hip. Trying to isolate more of this engagement through your center. And just moving back and forth here. Good. If that is feeling pretty solid, you might start to lift your right foot and then your left foot and then release right foot and left. With both legs off the ground, there requires a little more engagement through your center to make sure you don't start overarching through the low back. And just alternate which foot lifts first. Good. And releasing that. Take a little windshield wiper through the legs, side to side. And then we'll roll over to the right side, stacking the knees on top of each other. You can support your head with your hand, or allow your ear to rest on your bicep. And from here, with the knees stacked, your hips are stacked, engaged through your center, so you're not arching through the back. Your palm can be pressed down into the floor here. Good. And with your inhale, separate the left knee from the right without rolling the whole hip open. You're keeping all of this steady and just opening up that knee. And then release. The little clamshells here. Working on those deep lateral rotators. Good. And now you can always do this with a resistance band. But if you don't have one, just creating your own resistance is good here. So as you open, imagine you have someone pressing down on your thigh. And then as you close, same thing, imagine someone's resisting on the way down. So you might even do that with your own hand, just to feel what that difference is, the difference in the muscle activation with that motion, and see if you can recreate it, adding your own tension, imagining that hand there, and then bringing it down, that same tension. Good. About 10 or 20 reps is good here. And once you've done that, extending your legs, keeping the legs slightly in front of you. Straight leg lift out to the side, getting through those abductors of the hip, releasing down. This is all for those hip stabilizers. So again, some hypermobility or increase in mobility can destabilize the SI joint. So having a lot of stability through the hips, the muscles that connect to the pelvis, your core, can help prevent SI joint pain. Good, and you're really aiming the outer edge of your foot straight up towards the sky. It doesn't have to be a really high leg lift here. The rotation of your hip is not changing. Again, you're creating your own resistance. And about 10 reps is good here. Good, once you've completed that, and just rolling over to the other side. Again, stacking through your hips, stacking through the knees, engaging through your center, and then opening and closing the knee. Again, not opening up to the hip, keeping them stacked, really isolating that movement. You can try a few rounds by providing your own resistance. Notice the different in muscle activation with that resistance. And then can you recreate it without your hand? And again, 10 to 20 reps here. Then you'll extend your legs, feet slightly in front of you, straight leg lift out to the side. Good, so you're going straight up without changing any rotation in the leg, outer edge of your foot straight up towards the sky. And you might notice a difference in the rate at which your muscles fatigue side to side. Notice any differences in weakness side to side. And again, 10 to 20 reps here.